switch over to my, yeah, to the
Yes.
We're going to go back and forth a few times.
I know you don't, we have to move that light then for us to see your face right now.
You don't have to see it, just zoom in on the foot. Hello, anybody there? Show the foot.
Okay, you have two people.
Hey, Manju.
Hi, Royal.
How are you?
I'm good. How are you doing?
Doing good. We're going to do feet today.
Yeah.
Pretty cool, huh?
There's somebody else who could work on my feet.
You don't have anybody to work on your feet?
I'm going to work on my husband's feet, you know.
Well, you guys should switch halfway through.
I don't know how he'll do.
I bet you he would do good.
Okay.
So we're going to go through all the points on the feet and
Okay.
I'm going to explain where the organs are. Let's switch over to the anatomy picture. I'm going to show you a picture, okay, Manju?
Yeah. Go up, move up a little.
Do you see it?
Yeah.
You see the picture?
Yes.
Okay, so what I have in the picture there is I have an overlay of organs, including the muscles,
Oh.
on the bottom of the feet.
Yeah.
So you can see where the muscles are, you can see where the organs are. And I think what I should do is I should start with the heel. And
Yeah.
let's look on this picture. You see where the heel is? On the
Yeah. So should I?
the gluteal muscles.
The pictures that you're because it's left and right foot.
Correct. Yeah, and they're true to their side. The right
Okay.
foot is you know, the organs that you see on the right foot are slightly different than the ones on the left.
Yeah, yeah.
The organs
So
are
which
slightly
foot? So which foot are you going to work on?
we'll work on all of them. I basically want to come away from this where you have an idea in your mind of how to diagnose with the feet. So if someone has trouble with their body, you can tell what's wrong by their feet. And also, you'll be able to treat any part of the body by working on the feet.
Oh, okay.
So that's the whole point of this chart up here, is it tells you what you're pressing on from the feet. So look at the heel. You see how it has the butt muscles in the heel on my picture?
I'm trying to see. So because I noticed that there are different muscles, like different organs on both feet.
Yeah, okay. So the one on the left is
Okay. The left one.
and the one on the right is more of the organs. So on
Okay.
the right, intestine.
Yeah.
Yeah. And on the left, you see the butt muscles. And then that's in the heel part, right?
Yeah.
And then above that is the lumbar spine. And in the lumbar spine, you have more intestines and you have the low back muscles. And then as you come up towards the ball of the foot, you start coming across the viscera, like the liver and the spleen, pancreas, and so on. And that's where, like, if someone's having trouble with digestion, a lot of times they'll have trouble either in the intestines or the liver area.
Do you also have a picture of like this very picture labeled?
I do have examples of that labeled. Yeah, I do. You like the picture? But you don't need the label. You just look at the images on there and you can see which organ.
Yeah, no, I know, but it's like, okay, you can then see like, oh, here's the spleen, the liver. I mean, I'll be able to figure it out, but I just thought that it'll be nice to have that.
Oh, I should label, yeah. But do you see how the liver, you can actually see a picture of the liver on the foot picture.
Yeah.
And so that's exactly where the liver is on the foot.
Okay.
So, all right, let's do some techniques. So go ahead and show me on this side. And let's switch over to the video view. Okay, so you saw a picture of what's on the heel, right? So the butt muscles are down here on the heel.
Put this down.
Right in there. And also, like, if someone has sciatica, they'll have pain there. And the intestines come up actually on this side. Intestines come up on the right, and then they cross. And then they pick up on the left, and then they come down on the left and come out here.
Oh, so that's how it is. Okay, the complete.
The large intestine comes across like this.
Okay.
The large intestine begins here, and then the
Yeah.
right here is.
Yeah, I saw that.
This is all small intestine here.
Okay.
So, so if you're working on the heel and sciatica, and this actually it makes sense because you're releasing the Achilles tendon, which is on the same chain of muscles that goes up to the butt, right? So if what you do for this point is you pull the toes back like this, and then you use your thumb like that. This is too much pressure, like it should be good. There we go. So it's the same thing. You hold this stretch position, do pressure, and stretch it. And it's called yang mode. And then you slowly start backing your pressure out to release the point like this. Put him outside. Like that. There you go. Are you doing it, Manju?
Yeah.
Hey, Corinne, are you there?
Yes, I'm here, but my partner left, so I am by myself. So I'm watching you guys and I'm taking notes today.
Okay.
So,
Look on your foot, your own foot.
Yeah, you can.
I know, right? But that's cool because the foot is what I did. Remember Royal? That was my my homework.
Yes, that was your area, right?
That was my area. So
that video we took. I remember
That's why I did this one. I knew you wanted to do it, so.
That's a good refresher.
Yes.
So I'm listening. I'm here.
Okay. Well, and a lot of it's just going to be explaining the different regions too. Okay, Corinne. So what does this area go to? What does the heel go to?
That's the calcaneus.
Huh?
The calcaneus?
It goes to the butt.
Oh, sorry. Okay.
And switch back over to that picture. Here, let me show you.
All right, I'm here. I'm getting my book.
You see this picture? You see it?
Yes.
Okay, you see at the bottom, you see the gluteal muscles on the right, on the picture on the right, which is the left foot. You see the butt muscles?
at the bottom.
Oh, okay. Wow,
Yeah,
interesting.
so that's where they are. And the sciatic nerve is buried down in there. And then you can see the skeleton on the other side. You see kind of the hip joint. And then if you come up from the heel, I guess it's back over to here. If you come up from the heel, you start getting into the intestines. So like, let's say someone has constipation or indigestion, you get in here into the intestines and you do point release there. And if they're having trouble, these points are gonna hurt, right? So like if someone has indigestion or they're stuck in their intestine, and you press here, it's gonna be a lot of pain. And then what you do to fix it is you do, pull the toes back because you're actually stretching the flexor digitorum brevis muscle.
So it's this, but it's not the same on each foot, right? So the right foot is the one with the intestine, or both?
Well, they both have intestines, but on the right side, the large
I think
intestine.
major part, most of the part of the intestine is on the right foot.
Yes,
Yeah.
and on the left side, it's going down.
Yes.
Okay, so it's the ascendant colon on the right and descendant on the left?
Correct.
Yeah.
Oui.
Okay.
Oui, oui. I have to brush up on my French, Corinne. We'll have an entire class all in French next year.
It's on point. It's on point.
Okay, so what am I pressing on now? Can you see my thumb?
On the, is that the, what is this organ called in
Is it the
English?
stomach area?
No, not quite. I'm on the small intestine. This is the small intestine, near the belly button. The navel is right about here. Right there. Right in this area is the navel. And that's small intestine. Okay, and then the way to release it is the same. You pull the toes back and you just press in, pull. This is the yang mode where you're putting energy in, and then you slowly start backing your energy out. Try to trigger release. And you can actually feel sometimes if you can feel energy flow, you feel it go all the way, come out all the way from up in the body.
Oh, that's the spleen, right?
No, not the spleen. It's still the small intestines.
Okay.
Spleen is close by though. The spleen is really more on this foot, on the left foot. The spleen is up in this area, right here. See that? That area? That's the spleen. Let's try the spleen a little bit. So the spleen, it has a movement this direction. The flow of the spleen is this way. So you kind of do a release like this, but also like kind of everting the foot like this. So you invert the foot and then pull the toes back. And then you go into the point. So hold the point, slowly increase your pressure. Yeah. And then start backing your pressure out. Make it feel like you're backing out, but you don't go anywhere.
Les channels d'énergie.
Trigger the release. Boom. There we go.
C'est de la réflexologie. Quand tu appuies là, en fait, tu agis sur l'intestin, par exemple. Si tu es constipé, tu appuies là et là, c'est la nuque. En fait, dans le...
With hands. Okay, so that's how you do the spleen. Spleen's over here. Now the liver starts to pick up. The stomach is actually here. And the stomach picks up over here on this side. There. And then the liver is here. The gallbladder is right around there. So let's pick up. Let's go to the stomach right here. So to get the stomach, you pull the toe back, the big toe. Going like this. Slowly increase your pressure. Hold the
So
point.
Royal, whenever you release a muscle in the foot, you're not only releasing the muscle, you also activate those organs.
Oui.
It's a question, yes?
Yes, yes.
Oh, okay.
Yeah, it releases the muscle chain between the foot and the organ, which opens up the circulation and the restriction all the way between the foot and the organ it goes to. Kind of amazing how it works. Like it's really consistent how well it works.
So because when I first did this area, when I was studying this area, it was more for plantar fasciitis.
Yes.
So if you work on the plantar fasciitis, you also somehow touch their organs.
Yeah, totally. It's the same thing, really. And also, if you have organ problems, it's going to make your foot hurt. So a lot of times, plantar fasciitis is really a referred pain from an organ. Does that make sense?
Yeah, it does.
Yeah.
All right. So we went through the spleen. You know where the liver is? The liver's here, right? Can you see that? See the liver?
Is that the reddish area?
This area
Is
here.
that the thing that looks like a little baby curled up or
Like on the transverse,
Switch over to
the colon area,
I'll show you.
the large intestine.
Okay, so
Here.
you can see me now, right? Can you see? Okay,
Yeah.
so this area is the stomach, and then the liver is like here
Oh, okay.
on the right foot
Yeah.
to there, like this part of the arch right there.
Okay.
And you know what this represents? This is the ribs. In fact, let me show.
The rib.
I need to look like show on a body. Showing you. Okay. Right in here. Okay, so if you stand with your feet together, the where the feet come together, this area here, that is the same as the spinal cord. That's the spinal cord.
Oh, yeah. That's why you see on both sides.
Yes, and then the big toe, this is the head. That's the head, this is the neck, this is the spine. This is the front of the body, this is the side of the body. This is the side of the rib cage, and this is the low back in here. That's low back. And this is the rib cage. So the abdomen is in this area. This is the abdominal muscles. This is the chest. This is the side of the chest. This is the sternum. This is the head. The sinus is run between here. The ear is out here. That's the ear. And so it's basically the top of the foot reflects the front of the body. It's like if you were standing in shallow water and you could see your body in the reflection. And your head was somehow distorted, so it was kind of really wide across the toes. And your body lined up with your feet. That's how the feet match the body. So this is the top of the feet, which is called the dorsal side, matches the front of the body. Now the bottom of the feet, they go to the back of the body, right? So
the bottom is the dorsal and the top is the ventral.
Yes. So the plantar side of the foot, like the left foot is the left side, the right foot is the right side, and let's see how to explain it. So the toe comes up into the head on the bottom of the foot. This is the ball of the foot. The ball of the foot is the same as the scapula. See how the scapulas extend back from the body, right? You see that?
Yeah.
So this area is the same as the ball of the foot. If you look at the bottom of the foot, the ball of the foot has that same kind of symmetry where like this is the arch of the foot and then this is the ball of the foot. So this is the heel. So that's how it works. Okay. We have the best models. So, is that making sense?
Yeah.
Corinne? Manju?
Yes, yes.
Making sense? All right. So do you have questions about another body, or do you want me to keep going?
So basically, applying pressure to that particular area under the foot is you are treating that organ, that particular organ.
Yeah, yeah. The idea is the same pressure point release. So there are muscles in the feet. So whatever muscle you're pushing on, you have to stretch that muscle. And then you put pressure into it, and then you slowly back your pressure out to release it. So it's the same as anywhere in the body, but the points in the feet, you know that they go to specific points on the body. Same kind of technique, with a kind of awareness of what it goes to. So.
What about sometimes when they say like in between, like you go to these reflexologists, they have like the press between the toes.
It's the same, yeah. It's the same thing. That actually comes from Ayurveda originally, and then it's Chinese medicine picked it up after that.
Oh, okay.
And then there's a guy named Gerald Fitzpatrick that went to China, and he studied Chinese medicine, and then he came up with zone therapy. His student Eunice Ingham came up with foot reflexology. So it's really like Ayurveda, like repackaged.
Okay. The root is Ayurveda.
Huh?
The root is Ayurveda.
Yeah, like most things. Ayurveda is the root of Western medicine, and it's the root of Chinese medicine. 90% of Chinese medicine comes from Ayurveda directly.
Yes,
and
so yeah, I was having this discussion actually with a friend the other day. We were debating what came first, like the chicken or the egg. So Ayurveda or Chinese medicine?
Ayurveda for sure.
Ayurveda.
For sure.
That's what I said. I won.
Well, it's historical. There's a guy named the Bodhidharma who is a character who brought both Buddhism and Ayurvedic medicine to China about 1,500 years ago.
Oh, okay.
And most of Chinese medicine, including meridians, they didn't have the idea of meridians really formalized. But the idea of nadis came across with it, and then they like, okay, well.
Yeah, because in India, they work a lot with the nadis.
Yeah, it's all based on nadis and doshas, the 3 doshas. And they have the same, check this out. They have this tridosha points up here.
Yes.
Both points, right? Vata, Pitta, Kapha.
Yeah.
Those are the same in both ancient Greek medicine had that too, and Chinese medicine. And Ayurveda. Okay, so let's keep going on the feet.
Okay.
Okay, so looking at the top of the foot again, just to review, or we look at the bottom.
I know.
Look at the top. So right on the top, remember this is the abdomen, this side of the ribs. This is the chest. These are the sinuses in the head. Here's the head, and the brain is in here, and then the ears are out here.
Yeah, I hear that.
So let's see. So I'm going to do an experiment. I'm going to press around. Of course, I already know where Jordan has some pain, but yeah, it's not a good experiment, really. I already know where your trouble is. So this right here goes to the abdomen, which should probably go to like tension in here. Are you tight in there? Yeah, see the match. I know what I'll do. I want to have you guys actually do the techniques, and I'll hold the camera. Okay. All right. So I'm gonna have Marnie and Christina help me with demonstrating, and I'm gonna hold the camera, okay? And we can answer questions. So, all right, Christina, come in there.
Okay.
Is this the salsa for the pita chips that you got?
So say hi. This is Christina Bennett. I've been training her for a couple of years, and she's really amazing. So let me show you what she can do. Okay, we're gonna work on the feet, bottom of the feet, and okay, where do you have pain in your body right now? Do you feel any pain in your arm, in your back?
Yeah, my back.
Right here.
Up here?
Yeah, and you just said that abdominal and belly button.
And it's having some pain there too, right?
Yeah.
Okay, so we're gonna target a pain. I'm gonna have her work on it until it goes away. It goes away, you tell us. Okay, so which pain you want her to target first? The back.
Let's do back.
Okay, so the back is on the bottom of the foot, which is where you're already at. So palpate around and try to find the tightest point on the bottom of the foot. And tell me what feels like the most painful spot.
Right about here.
Yeah.
Too far? Is that-
No.
Yeah.
That's
Tight right there.
yeah, and that's the point that goes to the kidney. Actually, when you have trouble with your adrenal glands are kind of locked up. So.
Okay, somebody yin yang it.
Do the release. Give her a little bit more stretch. Yeah. No, leave more. Yeah, good job.
Do you feel it?
Okay.
Yeah.
Okay.
What's the whole idea? No, nail to कटे हुए हैं अब.
Stretch it more, Manju.
No
Push back
pressure.
over. Good job.
He says he doesn't feel any pain.
Press harder. Press harder.
Press harder.
Hey, how did his wrinkles look after last week? Better, right?
Yeah. Maybe I need to give him another session.
We always need more. Always need. We never catch up.
Good. I get free sessions.
You ready? Get a good pulse. A little bit. So the pain's starting to drop off. A little bit. Go. Out there.
You don't feel anything?
All right, my husband is back, so I'm gonna go down on the.
You're gonna get some work done. Right on. Yay. Tell him he has to be here for every class.
Am I supposed to feel pain?
What's up? He's really good.
He forgot.
Okay. Hey, at least you're here now.
No, actually, he didn't forget. He had a last-minute meeting, you know. So.
As of that day, I sleep on the bed.
A little wrap. So cute. So cute.
Anyway, just because I'm enjoying
I was just okay.
it.
If I don't have back pain, then it should be okay.
You're a guinea pig.
I don't have any weight.
All the plantar stuff. Try those. See if you can find the liver and the spleens around the side. The spleen.
Liver.
She has a lot of scoliosis too, so I think she has a lot of spinal impingement on the organ.
Yeah, that's the whole idea. You have to apply pressure.
I'm going to take you through a transformation. The last decade, you're still going to be feeling it. How old are you?
23.
You're 23. And how old are you?
About to turn.
Still 18.
2 days?
80s.
July 12th.
What's up? We're in the presence of babies. Smart babies. Yeah. Social media.
Yeah, we're the Gen Zs.
She does amazing stuff. I mean, she's amazing too.
Are you talking about me?
I was talking about you. How'd you know?
I'm kidding.
Corinne, I brag about you on a regular basis.
I was kidding.
I'm not kidding. There he is. Hey, how's your carpal tunnel? Still good?
Oh yeah, much better. Thanks.
Much
You're
better.
very welcome.
Gone. Yeah, it's good.
We fixed his carpal tunnel a couple weeks ago. Or actually, she fixed it.
He was really in pain, and then I mean, it's almost it's gone.
I feel better every week.
Yes.
It's his favorite. It's his favorite hour of the week.
Exactly.
Okay, so are you guys ask me more questions about the feet?
Okay, so you asked about pain. So right now it's upper back, right?
Yeah, upper left back.
Upper left side.
Okay, sure. The upper left.
Upper left side.
Upper back is going to be.
Upper back.
You know, if it's on the left side, then you have to be on the left foot, which is this side. And the upper back is in here because the scapula is like right about here. So the wrong way is going to be in this area, right there.
How will I know from the foot?
So work it like this. Pull the toes back.
Okay.
Really stretch the bottom of the foot. That would mean.
Show me again the upper back.
Upper back.
The upper back is in this area here. This area. You
It's
see
like
that?
the ball of the foot.
The ball of the foot. Just below the ball of the foot is the upper back area. Goes to the scapula.
Okay.
Okay.
Yeah, just like that. Okay, so you hold it. Hold that point there while you have the stretch. This is yang mode. So you put an energy in, holding the stretch, waiting for it to start warming up. And then it's going to start wanting to release, feeling like it's melting a little bit. And then you slowly start backing your pressure out. Make it feel like you're backing out, but you don't go anywhere. Keep it going, keep it going. You feel it relaxing? You feel it relaxing?
He's sleeping already, so.
He's out. Manju, do you feel it relaxing?
He's just liking it because He's getting up to
Well, he's going to have to work on you in a minute. This is not just a one-way street here.
How will I know?
It's better I do it, I learn and then do. He
No, I
will
can
learn.
do it.
Okay, okay.
Do you feel it?
Yeah, I feel it.
Okay. Is it starting to feel better in your upper back? Do you feel it? Do you feel it? Does it feel better in your upper back, Manju? Or Manju?
How is it? Do you feel anything? Do you feel any discomfort?
But the way you're touching it, I feel discomfort.
He just feels discomfort because the way I'm pressing it, he thinks.
Well, it should hurt a little bit. I'm asking, is his upper back starting to relax while you do it?
Not right now, because you're pressing it. What?
Do you feel
Foot,
relaxed though?
The upper back. Do you feel it in the upper back?
He says his back is not hurting right now, so he can't
Oh,
tell.
that's not a good way to test it.
No,
There's nothing worse for finding it. But if
Just
that is a fix, you don't feel the pain.
I cannot
You're not a
feel
good
it.
candidate, actually.
Are you sorry? Sorry?
Where do you feel it? Up here?
No, they can't come
Yes, we have confirmation. There and here. Cool. See it, it's working.
Yeah, it's just I'm pressing it. There are no nails.
Not that it makes me feel comfortable. Not anything else.
But that means maybe your back is.
Well, let's try,
All right.
okay, let's do the top of the foot a little bit, okay? So on the top of the foot, so this area is like the abdomen, right? And then here's the chest, like the ribs are here.
My bone is great.
Pourrait faire pour que le truc soit- Bah oui, voilà, c'est ce que je voulais.
Le mieux, c'est ici, quoi. Ici.
Moi, c'est moi qui vois.
Um,
Moi, je veux pas qu'on voit moi, je veux
I think he has to- No, no, he's better.
Can you guys see?
Yes.
Okay, so we're looking at the top of the foot here,
Mhm.
right? And this is the abdomen area. So if someone has pain in their psoas, like in the hip flexors, psoas major, you want to do a release right here. And this really helps low back pain. And it happens to correlate with the tibialis anterior muscle, which jumps across the bone here. So it really follows the line of the both feet. Yeah, both feet. So we're going to go right here. This can actually help low back pain and pain in the front of the hip. And I think it can help infertility.
So let's say you have pain in the right hip, it's more the right foot, right?
Then you go on the right, yes. So it's side, whatever side it's on, you go there.
De quelle faire sur moi?
So this is the hip flexor there,
left side of the
psoas major. Now, Corinne and Manju, do you remember what the psoas major, if you release the psoas major on the body, what happens? What can that help?
Well, your low back,
Soleus is
yes, it's attached to the each I mean L5 to L1, right?
Yes, you're right. And so if you release this muscle here, it releases the psoas, so it'll do the same thing. So that helps low back pain. And then also remember the genitofemoral nerve, the nerve that goes to the ovary or the testes, it comes right through the psoas, and this is the point that opens it up. So it's kind of a fertility and low back pain.
I mean, maybe not now.
Right there. So what you do is you plantar flex the foot while you do this. This muscle, it lifts the ankle like this. When it contracts, it's called the tibialis anterior.
There you go.
Stretching like this. Stretch, hold the point.
Ah, easy.
Yeah.
Yang, build up your energy into the point, and then slowly start backing your pressure out until it starts to release.
I can see how much pressure.
And then when you do this, they should get a release out through their shin. And the release should feel like it's going up this way and then out through the quad and through the psoas. Feel in your low back. Thanks so much. Gotta get it a little better. It's still pain.
activated.
So,
It depends.
Does it
I
depend
don't
on-
think it's like, I feel it's something like
Yeah, but
way
you
in
have to
one.
do regularly. You can do that. Or just like one time thing.
No, it's, I think it's like, it's not a one.
you're traveling.
These things we have to.
Personally,
Mhm.
often, and then you can get
Yeah.
Until the person gets rid of it.
several.
I don't think they have gorillas. They have monkeys.
Bah, alors, sont là, comme
They have pythons.
Ah.
Yeah, those gorillas are.
Oh, you need to see us.
Don't just drive through Colombia.
Il va chez Chic-Léola, comment je peux vous donner un bon petit par exemple.
Okay, so do you see what I'm doing on the top of the foot there? Is that making sense?
Mhm.
Okay, so this should release, you know, the ankle, and then it also releases the toes. You know, if you get up into here, you get into the muscles that run deep into. Someone gets like a hammer toe, the toes get kind of weird position. Then you can come in here and find the muscles between the bones, and they extend all the way out to the last joint. These muscles down in here. Yeah, they're called interossei muscles. So you can like stretch the toe kind of away like that, while you go into between the bones, and you can feel the tendon.
So is this also for lower back?
This is actually for rib pain. This is for thoracic.
Thoracic pain.
So if someone's having like kind of restriction in the rib cage, this will really open it up. And it also helps your sinuses, like if you have clogged sinuses.
Mhm.
The ribs and the sinuses are.
Gosh, that's nice.
See, so you're pressing in between, you feel the little muscles running in.
Yeah.
Yeah.
Down, and then you can kind of stretch the toe like this, take it away, and you feel it stretch. So while you hold
Yep.
this at the point, try to release it until you feel like the toe kind of loosens up. Yeah. Okay, let me go over to the next one. Again, in between the bones.
So the muscle between the thumb and the second finger and the finger, what does that go to?
The muscle between the thumb and the finger,
Uh-huh.
like my thumb.
No, on the foot.
Oh, the big toe.
The big toe, yeah.
The muscle between the big toe and the other toes.
Yeah, and the next and the finger next to it. The toe next to next. Yes, here.
So the muscle, what's the muscle between here, you're saying?
Here, yeah. So what area does that help?
This actually goes to, that's a good question. It goes to the esophagus and the trachea, the throat, basically.
So because when I press that muscle,
Yeah.
so it says that that area kind of hurts.
Oh, then that goes to his throat, in like the upper chest. Does he have a tension around his throat?
Ah. His voice goes husky.
That's
And
what
like,
it is.
like
That's what it is. So, okay, so what you should do is like really try to release these points here. Okay, pull the toe over, do a lot of releases down in here. And I bet you his voice will change while you do it. It'll change.
oh, okay.
So have him talk every like minute or so while you're doing this, and I bet you his voice will open up and sound less hoarse.
Mm. Okay, I shall work on this.
Yeah.
Because he feels like when I press the other muscles in between the toes, he didn't feel.
But he feels this one.
But this one he feels.
And he has a raspy, his voice.
Yes, yeah, uh-huh.
See, it's always a match. If you find something on the foot, you're going to find a match in the body every time.
Yeah, Corinne feels every muscle between the toes.
She really needed a lot of help with that. It's from all those yoga classes. She's tight everywhere.
It's all that pressure, you know.
Yeah, exactly. They stretch you out at the club.
Well, she teaches yoga.
Let's go into here. You know what this point is here on the foot? That point? That's the kidney, the hard spot there.
Okay.
Adrenal gland and the kidney's down here, actually. So adrenal gland on that BB, and then the kidney. So let's go into the adrenal gland. If someone's having trouble sleeping, you want to do this.
Ah,
Right there. See
right
it?
there.
That point.
It's like in the arch.
It's about like your arch is here, and there's kind of like a BB. It feels like a hard
Just
bony
above, yeah. Okay.
spot right there, and it's kind of painful usually. That goes to the adrenal gland. So you feel the toes back,
Sleep.
hold it.
Oui, j'ai quelque chose pour lui.
You release it there, it'll release your adrenal glands, and if someone's like not sleeping, they'll like get really sleepy. And if someone has low energy, you'll feel like a kind of a nice rush of energy, like a positive rush, like not stress, but like you feel like you have energy, you know. So
That's what,
the way you release it is keep the toes peeled back, keep increasing pressure, and then try to trigger a release. I'm gonna slowly back my pressure out now.
not easy to do.
See my
Standing is
fingernail changing color?
when you have the table.
Oh, no, I know.
So,
I did. They have out of stock for that one. The one you recommended, Earthlite.
Faut qu'on réserve pour ce week-end pour la piscine.
Ouais.
On va le mettre sur l'iPad comme ça, c'est pas que vous voulez.
That's for your kidney, sleep, tired. You're tired, low energy.
huh?
No.
Okay, so
T'entendais pas?
No. I like it.
Attention à ton dos par contre. C'est des affaires.
Yeah. Perfect.
okay, so see what I'm doing? I'm pulling the toes back. Still going after this adrenaline point. It's such a powerful point because you can really relax the whole body if you get that one point right there to let go.
The kidneys.
Want to try it?
It's for like, no, it's like if you are tired, sleep,
Okay.
maybe that's affecting.
Right, try it. I want you to try it too. Try it too.
Neil, cut them.
Oh, maybe not. No, medical fever.
You feel it? That hard little point? Yeah. This is such an important point to know. Right. Yeah. Close.
Oh oui, oui. So that's the. Where are you?
Huh?
Pour le.
The little bony thing right there.
You are back to the intestine, right?
No, we're doing the adrenal still.
The kidney,
Oh, okay.
kidney area.
Yeah, I'm having them both do it. This is such an important point because if you release the adrenal glands, everything else gets better. You know, the whole body will
Oh yeah.
relaxes and your stress comes down. Like you're ready for body work when you get the adrenal gland to let go.
So that's really okay. I can feel like that there's a hollow part basically, right? There's like a big muscle in the middle of the sole of the foot, right? And that's just next to it, between the ankle.
Well,
between the
there's
ankle.
this muscle, you mean? There's that muscle.
Yeah. This one.
And what I want to do is have you go over to the inside of the foot, and then here's the ball of the foot.
Right. Yeah.
Right under the ball of
Got
the
you.
foot, it's like a hard bony.
Yeah. Okay, got it.
So that's where it is, right on that hard. Feels like a BB. Little hard ball in there.
You said it feel like a what?
A BB. Like
Okay.
a little metal. It almost feels like a little like metal ball or something. Like hard.
Yeah.
It feels like it's kind of floating over the soft stuff under it. And the way you know if you get this the right way is when you start doing yin, they'll really feel like they're relaxing. Like you feel like your whole energy changed. Do you guys feel that? Does Corinne feel it?
Pain, relaxation.
You feel relaxed? You just feel pain.
Upper pain only.
Maybe it needs more work.
I feel relaxed
That's an hour. Thinking.
now when someone's touching my foot, so I feel relaxed. No, I don't.
So, all right, let's work up on the toes. Okay, we're gonna work on the toes a little bit. That's for a headache. Someone has a headache, and also to stimulate the brain.
Yeah.
Work on the big toe. The brain is right in the middle of the big toe there.
Ooh,
Good.
here.
quick before exam.
Okay.
The brain is rusty.
My brain is
10%.
You don't remember sometimes.
So you are in the middle of the big toe on the right or left side or both?
Well, I'm on the left.
The brain is on the left?
I'm on droite. She's on oui.
No, but the brain isn't it on
The brain
under
is on
both
both
the
sides.
toes?
The brain has, we have the brain on both sides, left and right.
Yeah.
The hemisphere actually goes, operates the opposite side of the body. And so actually, the left foot, you can feel it from the right side of the brain, but it releases the left brain, the left hemisphere. So that's kind of the weird thing about the feet is you can feel what I'm doing with the opposite side of the brain, but the release goes to the same side of the brain. That makes sense? Sort of. Oh, right there. And the way you get the big toe, the tendons that flex the plantar flex the big toe run along the bottom. So you basically have to stretch those back to really get the point to let go. Point's right in the middle, right there. So I usually give it kind of a squeeze and pull it back like that.
Oh, please. It's not too hard.
But that's why you have to apply pressure.
Okay. Now there's muscles on the sides of the feet, and I want to take you through how to work on those. They're called abductor muscles because they pull the toes away from the other toes. And we're going to get the one that goes to the big toe. It comes from the heel. It's called Abductor Longus. It goes from the heel over to the side of the toe here. So if it contracts, it pulls the toe this way. To release it, you pull the toe that way while you get into these points here. And this basically goes to the diaphragm and the deep part of the psoas, where the psoas comes in and attaches to the spine, and the diaphragm picks up here. So we're going to release the diaphragm and the inside of the foot. So like I said, this pulls the toe this way, so I have to stretch the toe this way to really get it. So I'm going to stretch it like that, pull the foot back, and then come in there with my index finger and stretch it. This actually helps bunions. So
That's really just on the muscle just below the ball there, the ball of the foot, or the ball of the.
The muscle goes all the way down to the heel.
Yeah.
All the way to here, and it comes up to there, and then it actually crosses all the way over and attaches to the side of the toe.
Yep.
So it's all that. So to stretch it, you're here, and you can get a pressure point here. You can do a pressure point here, and even along here, you can get one. So you can even start like on this one, but recognize that it's this muscle. So you pull the toe like this to stretch it, and then do your pressure there. I'm going to use a couple, like my index finger is doing the pressure, but I'm going to use this finger to make it stronger. Does that make sense? Yeah.
Yep.
Okay. So I'm doing yang, holding the pressure. Remember, this releases the diaphragm and the psoas at the same time. I'm going to slowly start backing my pressure out and trigger the release. See if I can feel the release all the way to the big toe. There we go. Okay, now I'm going to catch it up a little bit higher. I'm going to catch it up closer to here. So see, I'm pulling the toe over. I'm going to lock it in with this. And then I'm going to come in here with my middle finger and do the pressure. Yang mode. Hold it for a second. Okay, a few more seconds. Starting to warm up. All right, I'm going to start backing my pressure out. I feel like I'm backing out, but I don't really go anywhere. This contact right there is still feeling the release go through. Good point. It kind of melts. Okay, let's double check. The whole thing is relaxing pretty good, but I still feel a little bit down here. I'm going to try it again from the lower. All right, let's have you do this side. Should balance. Here we go. Do the stretch. And this hand has to kind of like pin the heel down while you're stretching across here. Sideways stretch. You feel the stretch from the big toe. Hold it. Hold it. Hold it. Increase the pressure. Yeah, increase it. Still increase it. Yeah, it's not hurting her at all. She's not a guy. This guy's really good. You don't feel pain.
No, I don't. I feel like I feel pain everywhere.
Wait, is he?
Well, I'm always killing. I go really heavy, and it's like super.
That's okay.
But you'd be surprised, like girls are a lot tougher. The way they're you'd be jumping off the table.
7:15.
Okay, so is it making sense, you guys? Are you still doing it?
Yep.
Yeah. It's going is good.
Right on. All right, now let's get the. We're going to do the same thing, but on the outside of the foot. Ready to switch over to the outside of the foot. So the outside of the foot, it's kind of the same situation, except for we're going to release the latissimus dorsi and the quadratus lumborum, latissimus dorsi, and even the trapezius. All are released from the side here. The muscle specifically on the foot is called the abductor digiti minimi. It comes from the heel here, and it comes to the little toe. So what it does when it contracts is it pulls the little toe out. So what we're going to do is we're going to stretch the little toe in. And while we do that, with this hand, it's a little tricky. You have to kind of, everybody's foot's different too. So. Yeah. And then basically you got to come in here under the fifth metatarsal. And while you're stretching the toe, your pressure point under the fifth metatarsal. So this is the strip that you're releasing. The muscle goes from here to the toe. You're going to hold the toe, find the point in the abductor digiti minimi muscle, and hold it while I'm holding the toe at the same time. I got the stretch, got the pressure into my thumb, put the pressure into the pressure point pretty good. Feel balanced. Now I can start the yang cycle where I start building my pressure slowly but surely. More and more into the center of the point.
It's the outside of the.
What
I'm going to start backing my pressure out. Here we go. Start backing it out. I'm making it feel like I'm backing up. And I'm
like this?
feel the energy going. Yeah, there's back.
Ouais, voilà, ouais. Exactement.
There we go. All right. So on the yeah, that's the best. I can show you guys shin splints. I'm going to show you how to fix shin splints.
Yeah, sure, yes.
Okay.
Theo?
So,
Not for this treatment.
all right, we're going to do shin splints. And this muscle here is called the tibial anterior muscle. It comes from the front of the tibia. It comes down here. It was remember the Psoas Major we were talking about. It jumps across, and it comes to the first metatarsal here. So it comes from here. And if this muscle gets locked up, it causes shin splints. Let me explain what causes this. The thing that causes shin splints or makes the tibialis anterior lock up is if you're not planting your heel firmly. So when you're walking or hiking or exercising, jogging, whatever, you always have to plant your heel and then roll through to your toes, right? If you're up on the balls of your foot, then it doesn't hit a receptor in here. It makes this muscle relax with every step. So every step, if you don't touch here firmly, this gets tighter and tighter and tighter with every step until it locks up. When this tibialis anterior locks up, it pinches a nerve called the peroneal nerve. There's two nerves, the deep peroneal and the superficial peroneal, and they both run through this muscle. So if this muscle is tight, it pinches two big giant nerves, and it's pinching them all the time. And that's all from not planting your heel when you're walking. So that's what causes it. So ultimately, people have to correct, how they're injuring it and how they're walking. But in the meantime, you can fix it by releasing the tibialis anterior. So let me show you how to do that. Tibialis anterior comes down here, like I was saying. And when it contracts, it lifts the foot this way. So what we're going to do is we're going to plantar flex the foot this way while I'm holding the point in the tibialis anterior. So the tibialis anterior is here. And when I, point the toe, you can feel the tibialis anterior stand up. So I'm going to point the toe, make it stand up. I'm going to press into the tightest part of the tibialis anterior, which is right about here.
It's telling me to walk.
Increase your pressure. It's kind of a mound of tight muscles, so you have to hold your balance. Don't slip off. And while you're holding this stretch, like start really going into that pressure.
You feel anything?
Make it stronger and stronger with every moment until you feel like it's going to start melting. Right about now, I feel like it can release. I'm going to start backing my pressure off. I can feel like I'm going somewhere, but I'm not really backing off. So back, and there we go. Feel the release. Perfect timing with that.
Some people relax. You can move the
Okay, so that's how you do it. Did that make sense, you guys?
Yes.
Yeah, yeah.
All right, now let's get the muscles that go to the toes. So there's a muscle called the Extensor hallucis, like my cat now, hallucis longus. It comes up here next to the tibialis anterior. So you go like this, point the toe, coming next to the tibialis anterior. If you go like this, you'll feel this muscle up here. Feel that? So point the toe, you feel it. Pressure into that muscle. Hold it. Start backing your pressure out a little bit. Trigger release.
Any more?
Here we go. Okay, so that's the extensor hallucis. Now let's get the extensor digitorum longus. Goes to these toes here. Comes up a little bit further out than the one that goes to the big toe. Actually, no. It's right. You go like, you'll feel the comes here. So stretch it.
Any more? Sorry.
Okay.
It's my dog.
What's his name?
Nemo.
No.
He's looking for me.
I thought you were supposed to be looking for him.
No, he's looking for me. So because he doesn't know where I am. I'm sitting.
Sounds like the sequel. Who found us? Okay, so now we could do the peroneus. Peroneus muscles are on the outside of the shin here. And they do a movement called eversion, which is this. And to stretch it, you have to do inversion. Eversion, that's eversion, inversion. So we have to do inversion to stretch these peroneal muscles. The longest is called the Peroneus Longus. It's here. Here, and it goes behind the metatarsal to the bottom of the fish from here. So the way you stretch it is like this. Well, you go into this point up here on the side of the fibula. Like that.
Okay.
Yes, okay.
Oh.
You stretch it, you hold the point. I'm going to continue to increase my pressure for a second. I think it's going to let go. And then start backing my pressure out. Make it feel like I'm backing out, and I trigger the release. Relax. Okay, now there's a little bit of work to do still on the top of the foot. You know why? Because there's some short muscles on the top of the foot that I haven't released yet. They also go to the toes. So let's start with the big toe. And these muscles, these short ones, they come from a bone called the talus bone, which is right here. The organ. So flexor hallucis brevis goes from here to there. Release that first. Find it, stretch the big toe, and you can feel the tendon coming over here. Stretch it, go into the muscle that you feel moving. Okay, my middle finger's the best. So, big toe, I feel it moving. Press into the muscle that you feel moving. And it kind of flattens out the top of the arch if you do it the right way. See what I mean? You're like flattening the top of the arch out. Okay, so I'm holding the point, increasing pressure. Now I'm going to start backing my pressure out to trigger the release. I feel like I'm backing out, but I don't really leave. Okay, so now the big toe should be getting loose. Yes. And now we're going to go for the other toes, which also it's called the extensor digitorum brevis muscle. It comes from here. Talus bone, same place, just over a little bit more. So I'm going to go into the extensor digitorum brevis right here. Oh, yeah, there we go. Feel the fat part of the muscle right there. I'm going to start increasing my pressure into that muscle. I'm slipping, sorry. Okay, I got it. Slowly increasing my pressure with the stretch. Just going to hold it down, not let it slip, and now it feels like it's going to start relaxing. All right, now I'm going to start backing my pressure out, make it feel like I'm backing out, but I don't go anywhere. And I feel the release going down to the toes. Now this is an interesting muscle because it actually goes only, it doesn't go to the little toe, it goes to the other three small ones. The extensor digitorum longus does go to the little toe. So at least one tendon goes there, but the short ones don't. So, all right, want to try these? Okay, so while Christina's doing these, I want to go over the points on the top of the foot. Make sure you guys got them. Okay, so where do you think the ear would be? Do you think it would be here, or do you think it would be here?
For what?
The ear, like the ear.
Oh, the ear is on the outside.
It would be there or there.
On the
There.
on the outside of
The outside.
Little toe.
Okay, and then how about the abdomen? Would the abdomen be here, or would it be here? There or there? Where's the abdomen?
More towards the ankle.
Good job. That's the abdomen. Yes. And then what's this up here, Corinne?
Is the torso?
the chest area.
Yeah, the chest.
So
Yes.
that's
Chest, yes. And then where is the spinal cord? Is the spinal cord here or is it here?
On the inside.
Yes, you guys are nailing it. All right, good job.
Good.
Yeah. I think what else do we only got like 5 minutes. Is there anything in particular you want me to show you on the feet? Give me a part of the body that you don't know on the foot.
any part of-
Le sunset, il est à 8h30, donc à 9h30, ouais.
How about eyes?
Oh, the eyes, okay. The eye goes here. That's a great question.
That's fine.
In here, you see that? You see that area? You see
Oh.
the toe, the indentation under the
Oh,
toe?
in between. So the soft portion of the toes
Yeah, where
and the ball of the foot.
that opening goes exactly to the eye. So,
Oh.
Les pieds, comme.
so this area here goes to the eye
Okay.
right there. And this is her left foot, so this would go to her left eye. You know, down to like if you had you know, like some like a was irritating the inside of your eye, you would get an irritating feeling here. It might get tight there. If the outside of the eye was having something irritating, you would feel it over here. Top of the eye and bottom of the eye. And this is the left eye. And
Oh, okay.
the right foot would be the right eye. So it's this indentation.
And mo-
And it does transfer, the eyes do get picked up a little bit on the top, but it's mostly on the bottom. Indentation.
Oh, okay.
What else?
Thank you.
Give me another one.
Nose.
The nose?
So
The nose is right here.
just close to the eye, below the
Yeah,
eye.
because the eye is here, and so the bridge of the nose is like here, and so the
Big
nose.
toe.
This is the brain's
Okay.
heartburn.
So-
Oh, heartburn is right here because it goes to the stomach. So heartburn is this point right here.
Moi, tu ferais mieux de-
You see that? Right under the ball of the foot.
on l'a testé au début, le liver.
That's heartburn right there, you guys. Showing our heartburn.
The liver is on the left foot or no, the yeah, the liver is on the left foot, right? Oh, the right foot.
The
Left.
liver is on the, you know, the liver goes over to the left side of the body, but it's
Left
mostly
side.
left.
Left.
The
It's
liver
on
is
the
on the right
left.
foot and it goes to the left. Because the liver has two lobes. It has a left side lobe and a right side.
Oh, okay. So
But the liver is bigger on the right. The heart's bigger on the left. Which is actually why the liver is bigger on the right. Because the heart's bigger on the left.
what about people who snore?
Oh, well, you should just like make them sleep in a different room. Just kidding. I'm joking.
No name, no name.
I'm joking. I'm joking. But the sleeping, okay, the snoring, you have to fix the throat.
You have to what?
The throat, you have to release the throat muscle.
Oh, really? The throat muscle? I thought it was more like in the nose, but it's
No, you have to release to fix the snoring. You have to fix the throat. That means that the
Your air passage is kind of this is
blocked.
blocked or
the strap muscles.
it's not clear. The air passage.
Well, this is plantar fasciitis is when you release all these muscles on the bottom of the foot. The main one is right through here. You have to release for plantar fasciitis. Is the camera?
Yeah.
You went black.
I know. Can you hear me?
Yep.
Can you?
Yeah, just the camera just cut out. Yeah, it went almost the whole hour though this time with that guy.
Oh, you're back.
Okay. Well, we're almost at an hour, you guys. Okay. Yeah, we're back on. So, you want me to show you the strap muscles really quick on the throat? It's totally
Yes.
different. But you want to show you?
Yep.
For snoring? Okay, let's do this. Okay, let's come over here. Show one.
Oh, we're gonna show it on the foot, you're saying.
No, not on the foot. You can't really do it on the foot. It's too involved. So
इसको मैं ऊपर लगता हूँ.
I'm gonna wash it.
these muscles here are the strap muscles. They come from the sternum. There's a muscle called the sternothyroideus. There's a muscle called the thyrohyoideus, and then the sternohyoideus, and then the omohyoideus. And all these, they can squeeze the throat. And if they squeeze the throat, they're going to make you snore. So the trick is to come along. The column of the throat is here. When you push in this area, you don't want to push into the throat. You want to lift the throat towards the base of the tongue. So you want to make sure that the pressure is going towards the base of the tongue and not in, or it'll be uncomfortable, right? So
So her head is tilting back a little bit.
can you see now? Yeah.
Yeah.
Okay, so
Is it that depression?
it's the depression down here is where the muscle starts. It comes from the sternum. And you want to come into these muscles and stretch the thyroid cartilage towards the base of the tongue from here. So it's hard for me to get my hands in the right angle on this, but the idea is, I'm stretching the thyroid cartilage. You can feel it right there, right from the trachea. Make sure you don't collapse the trachea. Stretch the trachea towards the base of the tongue.
Yeah.
And while you're doing that, you're going to stretch the muscles from the sternum with you. So right about there, that's enough pressure. I'm going to do yang.
I feel the big vein right there.
Huh? So I'm going to do a yang yin pulse, see if I can release the sternothyroideus muscle, the first of the strap muscles.
I feel the pulse. I feel his pulse.
Good, that means you start getting some release. Okay, now we're going to come between the thyroid and the hyoid bone. The hyoid bone's here, the thyroid cartilage is here. So right in between is the thyrohyoideus. Thyrohyoideus. I'm going to stretch that muscle towards the base of the tongue without pushing into the throat. All right, I can probably put some more pressure there. I'm going to try to get a quick release. So basically, that's what you do. You just get the releases on that column of the strap muscles, and if you get it enough, do it really thoroughly, the snoring stops. Like it totally stops, and it always works. That's it, pretty much. All right. Any more questions? How was it? Good class?
Good.
What do you want to do next week? I was thinking of doing the belly, the abdomen.
Guillaume is loving the throat. He says he feels it.
We'll keep on doing it, and he won't snore tonight. Go ahead and keep on doing it for the next hour.
Can you do something wrong in the throat because you feel this big? There is
Of course, he'll let you know. He won't. If you do anything that's horribly bad, he just won't let you do it. So. You're safe.
No, but I can't cut circulation to a point that is dangerous.
Well, as long as you stay on the muscles, because the vital organs are down in down in the gap over here and the gap over here, but the trachea is relatively safe as long as you don't
Don't press too hard on it.
Yeah. As long as you're going up, like going with the trachea, you're fine. You want to bring the side of the muscle across the trachea, but you can easily do that without compressing the trachea. So that's the trick. You really want to feel the muscle stretch from here, like up into there. Slide along until you feel the muscle stopping you and then do the releases. This is really amazing for snoring. I actually have people that send their spouses in to see me for this. And it always works. Like a year later, they come in again. Pretty cool, huh? There you go. Feel it? Feels
So
good,
that's the sternocleidomastoid, right?
right? And you know, this releases the thyroid gland. So I had a client that was like about 400 pounds, and I released this on her, and I didn't see her again for about 9 months. And she was all the way down to like 150 pounds. And she was eating more and more active.
Oh, so it helps with the thyroid gland?
Yeah, all I did is I released the thyroid gland. And the next time I saw her, like, was 9 months
Yeah,
later.
because it sits right here.
She
So
looked
it's
like
the muscle is the sternocleidomastoid, right?
no, it's not.
No, that's
Huh?
on the side.
No, the sternocleidomastoid is here.
It goes from the side.
Yeah.
Okay, so which one were you talking about?
They are called the strap. S-T-R-A-P. Strap muscles.
So is this running from the base of the
So there's 4 muscles.
Show me again. Guillaume also wants to lose like 150 pounds. No, I'm kidding.
So they're called the strap muscles, and they're only right on the trachea. They're only right here.
Right on top of it.
Yeah, they're not even down here. They're not
They are on top of the.
there. They're not there. They're right on the trachea, right there.
So it runs parallel to the trachea.
Yes.
Okay. So where does it originate though?
The first one begins with the sternum, so it's called sternothyroideus.
Okay.
Sternum to the thyroid cartilage, and then there's the thyrohyoideus, which goes from the thyroid cartilage to the hyoid bone.
Okay.
And there's one that goes all the way from the sternum to the hyoid bone called the sternohyoideus.
Mm.
And then there's a thing on the scapula called the omoid process. So there's one that comes from called omohyoideus, a long one. And those are the 4 that'll compress the thyroid gland. Their job is to actually squeeze the thyroid gland when you swallow. So a little bit of thyroxine is released into your body right when you swallow, because you're probably swallowing nutrients. And the thyroxine tells your pancreas to wake up, and insulin hits your system. So by the time you're starting to digest food, insulin's hitting your cells. So it's already starting to like absorb the sugar. All connected to swallowing. So swallowing is the mechanism that starts the release of insulin. And if these muscles are stuck, the thyroid gland's not going to secrete thyroxine, and the pancreas is not going to get the message. So you're not going to get normal insulin flow. So these are so important to keep these relaxed, please.
So you can stretch them by yourself, right? Actually, you can do it. You can do a self-release.
I think you can do
Yes,
self-
yes, you can. Yes, you can. Just don't choke yourself.
No, yeah.
We don't want any like bad injuries.
It's a gentle move.
All right, you guys. I'll see you next week. We're going to do the belly, and I'm going to show you all the organs, how to help the organs directly.
Sounds
Oh.
good.
All right. Practice the snoring thing. Thank you for coming.
Thank you,
you.
Val.
Okay, Rachel, yeah, can you remind me, how do you watch the recording?
What?
How do you watch the recording?
You recorded the session, right?
Yes. And I'm going to post it on the website. So go to the Learn to Give page. And on the
I think last week's session isn't there, right?
No, it's there. It's on the top. It's the very top one from last week.
Oh, is that? Oh, okay. I went all the way to the bottom. Okay.
I know.
I went to the oldest one.
So,
Okay.
yeah, I'll put
That's
the
good.
site on by like probably tomorrow. I'll post it. So
Thank you.
thank you so much, you guys. I really appreciate you coming.
Thank you.
Thanks. See you
Good
next
luck.
week.
All right.
Have
Bye.
a good one.
Thank
Bye.
you.
Bye.
Awesome.